Welcome to part 2 of the compensation test. So this video is meant to be watched if you've done part 1. Please do not watch this video if you haven't done part 1 of the series, and here's what that video looks like. So please go there first if you haven't done so already to do the test, and now we're going to be talking about your results. And it's important that you do the test first, because if you listen to this explanation of how to interpret the test, it will change how you do the test. So it's really important that you not know or understand the intention of the test first, other than to determine whether you've got some kind of compensation pattern happening, causing your pain. Having said that, let's go over your test results. The first key to understanding this test is to understand that your brain is wired for success. If you're going to be walking down the block, your brain knows exactly how to do that the most efficiently and the best way for you to not have obstacles, which means you're not going to be skipping down the block, you're not going to be doing jumping jacks down the block. Your brain has figured out the best way for you to get down that block the most efficiently and the least painfully. Now, knowing that your brain is basically wired for success, for the single leg standing test that we did in video 1, your brain subconsciously will choose the leg that will be most successful. So whichever leg you used first on that test is what your brain believes to be the stronger and more successful leg. I'm going to take a moment here to ask you to please subscribe, like, and very importantly, please share this video with others who are suffering from chronic pain. This type of information helps solve chronic pain. So please share it. That's why I'm making the videos. The second leg will therefore be your weaker or less successful leg doing this test. Why does this matter? If you have pain in the same leg or on the same side of your body that you used that leg with, that wouldn't make a lot of sense, would it? Because you would think that your brain wants to avoid the side that's painful. Instead, your brain understands that the side that you're having your pain on is actually your stronger side. And when you did the other leg, this should have confirmed that the first leg you used was actually the better leg at doing the single leg standing test with than the second leg. What this means is that your second leg has some problem that subconsciously your brain is avoiding. And so it's making you use the stronger leg, even though that's the side that's painful. What does this mean? It means that you are compensating likely for an opposite side problem and throwing that weight over to the stronger side. Basically, it's breaking down under the extra load that you're asking it to carry. How much extra load? The difference is the amount of difference you felt in your mind between the two legs. Let's say you did the right leg, you stood up with your right leg first. We're going to call that your good leg, and it's the stronger leg. And so we're going to call that 100% strong. What you need to do is compare your second leg to the first leg. If the first leg is 100% strong, then what is the second leg? Clearly it's weaker. It's not doing as good of a job, or else your brain would have chosen that leg first. So how much weaker is it? Just take a guess as to what percentage you would guess it's weaker than the good leg. Whatever that percentage is how much the good leg is carrying extra. In my experience working with a lot of people with chronic pain, I'll frequently get that the bad leg or the weaker leg is 50% weaker or 40% weaker. And what's really interesting is that when I ask them to judge this, and I've just watched the test, and they say, maybe it's 15% weaker. And I'm just like, are you kidding me? You could barely stand up on that other leg. Why are you saying 15% weaker? It's at least 50% weaker. And they're just like, oh yeah, I guess you're right. Yeah, I really did have a hard time with that leg. I said, for sure you had a hard time with that leg. So this is where that video comes in that I asked you to set up when you did the test. If you did the first leg and that's your stronger leg, you may notice that your body is compensating on the weaker leg in order to get this done. What are those compensations? Well, oftentimes the body will lean hard to one side, or the knee will collapse in, or you'll have a lot harder balancing issue on that weaker side. So look at how your trunk is, because everything should be straight up and down. You should be standing up and sitting down, basically like a squat. And maybe your right leg or your first leg, you did that pretty well. But the left leg, the knee's all over the place, the foot is collapsing, you're leaning, your arms are all wailing all over the place. If you weren't allowed to do any of those compensations, would you even be able to stand up on that second leg? You can go ahead and try it if you want to. Try to stand up on the second leg using the exact same strategy that you used on the first leg. And again, this is where your video comes in really handy, because it can show you exactly how well you did with each side. We've determined that the first leg that you used is the stronger leg, your mind believes, subconsciously. And if that is the same side of your pain, one-sided back pain, sciatic pain, SI joint pain, then likely you're compensating for some older problem on the other side. Now, if your pain is on the right side, but you used your left side first, well, then that makes a lot of sense, because you're avoiding the weaker and painful side. In that case, the side that you're having pain on is actually the weaker side, which is intuitively what we would guess. But you wouldn't believe how many people I see with chronic pain, one-sided pain again, who have this compensation pattern occurring that their practitioner hasn't been able to figure out. If you have pain on your right side and your right side is the stronger leg, all of your practitioner's focus has been on that right side. They haven't even understood that the left side is the problem. This is the big secret that I have found, is that this simple test will show you whether your problem that's causing your pain is on the same side of the body or the opposite side of the body, using this reasoning. This has been a real eye-opener for hundreds, if not thousands of patients that I've worked with. So I hope it helps you understand where is your pain. Now the next question is, what's the problem on that side? Well, you have to delve into a little bit of your history to understand what that is. And with my other patients, once I've determined that they are compensating for some older problem in the other side, then that's the next question I ask is, what is that problem? And a lot of them are left scratching their head. And the reason is because we're not trained to link older problems with current pain. And so this will be your job, is to really think back. And I don't care how obscure you think that that problem is, like, oh, well, that happened 20, 30 years ago. That can't possibly be the problem. Your body is telling us something else. Your body is saying, I think that's the problem. Or maybe you have 2 or 3 things that happened on this other side. Well, maybe all 3 of those things are the problem. Remember, your brain is wired for success. So if this side that has the problems isn't up to par, all your brain is going to do is shift your weight over to the other side so it's not painful. Now this other side is carrying more load and breaking down. This is why you don't know that there's actually pain on the first side. It's because your brain has made these subtle compensations, unaware to you, that have gotten you off of that problem so that you can walk down that block without pain, or do that sport, or do that job, or exercise, or whatever it is that you're doing. Your brain has figured out the best way to do that. Well, oftentimes that includes compensations for older problems that you haven't adequately rehabbed. I hope this helps you figure out the origins of your pain. It's been a real eye-opener for a lot of my patients, and I think it will be for you too. Now, if you want to explore my information more, I've of course got other YouTube videos. You'll see a couple links at the end of this video. And I've also created a masterclass that is free. You can just sign up. That link is below in the description area. I also have home programs to help people solve pain from head to toe. And I offer a discount code in the description below as well. And you'll also see a list of my other videos that I think will be pertinent to you.